All right, it is noon. Anybody who knows a meeting by me, I really like to start on time because I value your time, and I know that you're taking time out of your day, especially out of your lunch, to come and learn while you're eating. So my name is Grace. I am the Washington State Department of Veterans Affairs Wellness Committee chairperson, and thank you so much for being here. This is our first in a series of lunch and learns that we are putting together as a wellness committee. At the end, I will be talking about some of the upcoming ones that are happening in the next few weeks. But I want to turn the time over to Keith first, just as a quick introduction. Keith has been a licensed mental health counselor in Washington State for over 25 years, specializing in trauma for over 15 years. Before becoming the director of counseling and wellness here at DVA, Keith was the mental health and veterans court program manager with the Thurston County District Court and had a full-time private mental health practice in Olympia for 20 years. During this time, he spent 16 years providing mental health therapy to veterans and family members through the DVA. In addition, Keith conducted over 45 trauma workshops throughout Washington State. So this guy knows what he is talking about. Thank you, Keith, for taking your time out, and I'm going to turn the time over to you.
Grace, thank you. And thank you for helping me out with the PowerPoint as well. I really appreciate that. So welcome, everyone. I usually do a little bit more of a formal introduction. This is a presentation usually take about 3 hours to do. I'm going to condense it into an hour. So I'm going to just hit the ground running. So I appreciate Grace also doing the intro. That saves me to talk about my least favorite part of the training, and that's myself. So what we're going to start off with is just getting some basic understanding as we move through the training. Presentation. So one of the things I want you to just introduce is under understanding of what's called psychological distress. So psychological distress in my field means the impact that a real stressful event or trauma can have on someone. It affects a human being in 4 different ways. Oh, before I even jump further, please let me know right away if you can't hear me or something happens with me with visually as well. So back to psychological distress. So psychological distress is when the impact trauma or real stressful event has on someone, and it impacts somebody in 4 different ways: emotionally, mentally, physically, and behaviorally. So when we think of trauma or a real stressful event impacting someone emotionally, what kind of emotions have you experienced or seen in other people? What kind of feelings come up around a stressful event or trauma? And just feel like you can put it in the chat, or you can just kind of open your mic and just say whatever feelings that come up around, like that you see or observe or may have experienced yourself around trauma or stressful event. What kind of feelings come up?
Shock.
Anger. Really good one. Nice. What else?
Anger.
Anger. Good. Anger, rage. What else comes up? We have fear, anxiety, and then on the other side of the spectrum, we have detachment, disconnection, dissociation, things of that nature. When you think of the impact mentally that trauma can have on a human being, what kind of things do you think what kind of things do you observe in or heard of or have experienced yourself with the impact of trauma on someone mentally?
I shut down.
Shut down, really good. So they can shut down, you can see hard to make decisions, confusions, things of that nature. What kind of impact do you think trauma can have on somebody's body? What kind of things can be impacted physically by trauma or a real stressful event?
Breathing and heart rate.
Yeah, increased breathing, increased heart rate. Very good. Anything else physically?
Sleep,
adrenaline.
deprivation.
Yeah, sleep, adrenaline, you got it. And you can also see like the digestive issues, headaches, things of that nature. Finally, what kind of impact do you think trauma can have on someone behaviorally? What kind of behaviors can you see around a trauma reaction?
Irritability.
Irritability, yes. Increased anger and making decisions around that. I'm sorry, somebody else said something.
Substance use.
Substance use, yes, good, good. So as we go along with this presentation, I want you just to stay aware, and I'll bring it up again about psychological distress. One of the things that just, if you remember one thing, please, from this presentation, psychological distress is a normal reaction to an incredibly abnormal event. Grace, if you don't mind, the next slide, please. So when we look at like understanding compassion fatigue, secondary traumatization, vicarious trauma, we just want to give some general information to begin with. So in the helping field, up to 60% of people will experience some form of compassion fatigue, vicarious trauma, and secondary traumatization. It is in the helping field truly an occupational hazard. In my over 30 years experience in the mental health field, I don't know of one other therapist that hasn't been impacted by either compassion fatigue, vicarious trauma, or secondary traumatization. Now, whether they were aware of that in the moment, that may be a different thing, but just as years have gone on and we've talked to each other, we've all been affected by this. It has a significant impact on someone's life. Everyone's vulnerable to this possibility. So what that really means is you've done nothing wrong when you develop this. If this were to happen to you, it's not like you went about business the wrong way, and we'll understand it as we delve into it. It's also important if you recognize this in yourself or someone else, things can get better. Next slide, please.
Hey, Keith, we had somebody from Meade School District request that you describe what abnormal means. Normal behavior
like
based on abnormal action.
So when we look at psychological stress, what we want to understand that it's a normal reaction to something that's very abnormal, something that you would normally not experience in someone's life, or it happens only to a few people. The majority of the time it doesn't. So a lot of times we're talking about a trauma event. So one of the things that we want to understand is what we mean by a normal reaction is if something horrific happened to me and I just kind of say, oh, I'm just fine. That's not a normal reaction to a very painful event, like a natural disaster that wiped out your home, or the sudden and tragic loss of a child. Uh, Things that are a violent act that just you had no idea was coming, or a sexual assault, or things of that nature. So I'm hoping that answered your question. If not, just flag me in the chat as well. And Grace, thanks for notifying me. So in my field, we have a diagnostic manual called the DSM-5. Actually, DSM-5 TR. We had a revision of it recently. So one of the things that there are disadvantages to a diagnostic manual, and there are advantages. One of the advantages is simply straightforward. You can develop universal language. So if somebody says to me, hey, I'm working with somebody that has a major depressive disorder, recurrent, without psychotic features, I have some idea what that means. I may not know specifically to that individual, but in general about the condition, I have some idea what that means. Unfortunately, the DSM-5 TR, the revision, hasn't defined what compassion fatigue is, vicarious trauma, secondary traumatization, and burnout. As a result, what happens is a lot of people use these terms interchangeably when they're actually very distinctly different things. And we're going to learn about that right now. We're going to spend the least amount of time on burnout, because burnout is just something most people are pretty darn aware of. But we'll spend a little bit of time on it. The first part, next slide, please, Grace, is compassion fatigue. So it's really, really important that when you understand compassion fatigue, that it is a truly an accumulation effect. It is the impact of trauma or really stressful material and repeatedly intrusive on you. You're repeatedly exposed. That'd probably be a better way to put it. You're repeatedly exposed to that. So we're going to take a little bit of moment just to talk about this. If we think about stressful events or trauma, how do we get exposed to that kind of material? Doesn't mean you have to directly experience, you're just exposed to it. What kind of different ways can you get exposed to it?
Media.
Media, huge. Social media, TV, movies, at work, it could be reports, it could be news updates, it could be the actual work that you do. We're inundated with trauma material or real stressful events throughout the day with just exposure from one material after another material. So when we think of compassion fatigue, we think of that accumulation effect over time. It is the gradual erosion of one's ability to connect and empathize and have compassion with another human being. By the way, that erosion includes to ourselves. So we become less compassionate, less tolerant of ourselves, and of course, other human beings. We lose our empathy, our hope, and compassion. It can impact anyone in the helping field. Next slide, please. What we can see with compassion fatigue is the lead to resentment, what we call clinical error. In other words, poor judgment goes in that. We're not reading what's actually going on. We're not observing it accurately. That leads to poor judgment. We have a loss of respectful stance for others, and that could take many forms, from being rude to cutting people off to just saying, just stop listening. It can lead to a lot of experience of anger and guilt in one's life. Over time, it can develop into anxiety, depression, substance abuse, and chronic pain. So next slide, please, Grace. Thank you. So I just gave a quick example. I used to do contract work with DC YS a number of years ago because I specialize in the area of trauma. And I developed a lot of professional relationships with social workers that have just been wonderful. And I'm talking about in this situation, a social worker that I had a really good relationship that suddenly just became very agitated and angry and did not understand why. Even became frustrated with me over things that just would normally be insignificant. And she's talked about how she couldn't feel anything anymore, that she just felt kind of numb, and that she just didn't want to hear about any other person's pain. So of course I told her to talk to her supervisor. One of the impacts it had was she was an excellent social worker, but it did affect her judgment. I just talked about briefly an example where there was a new set of foster parents. There was a placement of a foster child in the home. Forgot to pass on really important information to the foster parents that led to an incident that had a huge impact on that placement, those foster parents and their daughter. So what we see again, just with compassion fatigue, that accumulation effect, that inability to connect with another human being, our inability to be compassionate towards ourselves, and it can have a real impact on functioning and how we do our jobs or our relationships in our personal lives. Next slide, please. So vicarious trauma, again, it's not the one event. It's an accumulation event. This is an impact, again, it has on repeated exposure to either really stressful or traumatic material. It is not the most painful event that you've gone through. It's the thousands and thousands of exposures that you happen over time. So what we see is the first thing that we see that's changed with vicarious trauma is somebody's worldview starts to see really shift. And what we begin to see is an impact in the way we view the world based on the impact of all this material. What you typically see is people begin to become more angry about the injustice of things, more frustrated, more sadness, experience less joy, experience less gratitude and happy feelings and things of that nature. Real impact, a real shift in a person's belief or worldview. Next slide, please, Grace. The second aspect of it is that we begin to see this intrusive material impact somebody in their personal lives. So what we begin is having more thoughts about what they experienced that were traumatic material or stressful events. We have a harder time shifting gears from work to home. We start to have nightmares or dreams that are just very upsetting about exposure to the traumatic material or stressful events. We begin to feel like we're actually going through those painful events ourselves. We see increased anxiety to the point where it's really important, because the last part on this slide, becoming emotionally numb or detached from other people's pain, This isn't our lack of ability to be empathetic and compassionate, like compassion fatigue. We become overwhelmed by our compassion, so we begin to disconnect from it. And how we disconnect is we become numb, we become detached, or we disconnect, called dissociation, where we just disconnect from our body or surroundings. And so it's important distinction is that we don't lose our compassion, but we may pull away from our compassion because it overwhelms us. An example is Cindy. She gave up being in corporate America, where she was incredibly successful, to doing something what she called, in her own words, very meaningful. She started to work for the Family Support Center here in Olympia. So if most of you are based in Olympia, you're probably familiar with that organization. However, she was with that organization when they were actually working out of a basement of a church. And so that's where the homeless shelter was. And what happened is she kept getting exposed to um, uh, one traumatic event and stressful material after another. And in her words, she began to see the world in terms of homelessness. She said, I saw homeless people everywhere, in the store and restaurants, wondering if they're okay. And and so you saw that shift in the worldview. You saw that intrusiveness. She began to become really frustrated all the time. Why would we let these injustices occur? She began to experience nightmares about stories she's overheard, and she just became more and more impacted by that work. It had such an impact on her. She actually had to leave that position about 4 or 5 months after being with the Family Support Center. She began to report that she felt like things were normal again. So again, we see the impact of vicarious trauma. It's an accumulation effect. It's not the worst thing. It's the thousand of things that we're exposed to. Next slide, please. So secondary traumatization is more rare than the first two. When we say secondary traumatization, what we begin to understand is there's an event, and often it could be a one-time event, where it's so painful, it actually causes the person to be in psychological distress. Sometimes you'll see that with like a juror that got exposed to graphic details about a violent crime or a sexual assault. And what that psychological distress can actually lead to the development of PTSD. There's some research with secondary traumatization um, where it seems like people develop secondary traumatization when they have had trauma in their life previously, but never got an opportunity to work through it. So secondary traumatization is the actual impact a event can have. It's usually very traumatizing in nature. However, it didn't directly experience, but they were exposed to the material that begins to have the person enter psychological distress, what we talked right at the beginning, the impact that trauma has on someone emotionally, mentally, physically, and behaviorally, and it can lead to the development of PTSD symptoms. Next slide, please. So there's something called moral distress. Moral distress, what's the best way to do it? So there's something in the psychology field, called moral um, distress, would be called moral injury. And moral distress leads that to the development of moral injury. Now, moral injury, the easiest way to explain moral injury is I'll steal from what's called cognitive dissonance. Cognitive dissonance, it's an old theory, but a theory that's been actually really well researched. Cognitive dissonance explains that we seek cognitive consistency. Cognitive consistency just simply means who we really believe we are versus objective reality, who we really are. We want that to line up really well. So if we had two whiteboards here and we listed all the things that you think you are, we would want objective reality to list, yeah, this is who you really are. So what cognitive dissonance tries to explain is what happens if we learn something about us that we didn't believe was true, or we thought that's not who we were. I'll pick on myself. We'll do something extreme. Let's say I have an issue with lying. So I think personally I'm an honest person, but I start to get information where I get confronted by someone, something happens in my environment where it becomes clear I haven't told the truth. So cognitive dissonance says when that happens to someone, that creates stress, anxiety, discomfort, that we're going to do one of three things. One, we're going to accept the fact that we are what objective reality told us. In other words, I accept, I lie. I don't tell the truth. That is what people rarely ever do that. Number two is what people hope they would do. And using me as an example, I would look myself in the mirror and say, Keith, listen, you have to tell the truth even when it's really hard. And I'm going to put conscious effort into it because I believe I should be an honest person. And I want to be an honest person. Most people believe they do number two, but what research shows is most people do number three. Number three is I develop a narrative to explain the differences away. Everyone tells a white lie every now and then, right? Oh, I was just kidding. I don't know why they took that so personally. I was just messing around. So what cognitive dissonance in its research says, we have a tendency to create narratives to justify incongruent things about ourselves, who we think we are and what we are in objective reality. How that relates to moral injury is the following. What if I do something under a set of circumstance that's so against my moral code, or I don't do anything that results in me being against my moral code? How does that affect me? Well, if we go back to cognitive dissonance, what we can't say is, well, I'm going to look myself in the mirror because the event already occurred. There's nothing I can do to change that. It already happened. Well, then I'll use a narrative to try to explain that away. It's so powerful and overwhelming. I can't just come up with a narrative to justify that incongruency and with a moral injury. What am I left with? Acceptance. I'm really a bad person. I did something awful. I'm going to burn in hell. So that's the painful part of moral injury. So moral injury has a huge effect on someone's life. What people experience as work is get back to moral distress. We have moral distress, right? If you work for an agency that has a bureaucracy, we have to sometimes say no to things that we don't want to say no to, or that's painful. Or we have to go along with something we really disagree with. If that happens over time repeatedly, that begins to develop, it can also develop vicarious trauma, but it can start to develop into a moral injury. I use a quick example when I worked at inpatient unit and we had to release someone just because of money when there was a young person for the first time in their life were doing well. And I disagreed. I wouldn't do it. It wasn't like it was going to bankrupt the hospital or something. That put me in moral distress. So the next one is, next slide, please, Grace. Thank you. Burnout. And burnout is just simply put, it's the low job satisfaction as a result of the job itself. It's usually not anything bad's happening at a job, but you're in a situation where it's just overwhelming, having high caseloads, working with homeless human beings, but feeling like you're not making a dent. It's just the impact that over time, it becomes harder and harder to have energy to do the job and keep going. Burnout can lead to development of compassion fatigue, vicarious trauma, and secondary traumatization. That is in some research. Next slide, please. Just to let you know what, in case you're experiencing burnout, here's some symptoms. You answer the phone by saying hell. Your garbage can is your inbox. Visions of upcoming weekend help you get through your Monday. Your phone exploded a week ago. You think about how relaxing it would be if you were in jail right now. Hopefully a little bit funny to you. So what we're going to do is do a quick 5-minute breakout session where in those rooms, just discuss from your point of view the differences between these four things. And again, we'll keep it pretty brief because we only have limited time. So 5 minutes, just discuss what you see are the differences between each other. And there should be around 5 people per room.
Right,
Grace,
I'm
thank you
setting it
so
up
much.
right now. Whoops.
Hello?
Yeah, I'm working on it. Sorry. Trying to get the right number. There we go. Creating the rooms, working, and open. We'll come back at 12:30.
Thank you, Grace.
Hello. Are any other folks here?
Here. Okay. So the question was signs of burnout. What signs of burn was that the question? Sorry, I was working on a
Yeah.
room.
Yeah, signs of burnout. And he mentioned, like the garbage can is your inbox and your phone exploded a week ago. And um, yeah, so I guess for me, it would be I'm feeling like I don't care as much.
Hmm. For me, the garbage can is your inbox. I don't even want to talk about my garbage my inbox right now. I've never thought about what it would be like in jail if jail was relaxing.
Me either. That would be really sad.
Yeah.
I can say that I haven't been that burnt out.
So visions of upcoming weekend help you make it through your Monday. Sometimes you now answer your phone saying hell rather than hello. That would make me laugh.
Mhm.
Um,
I have a
yeah.
thing of thinking it's a day ahead. For the last 3 weeks, I've thought Wednesday was Thursday, Thursday was Friday. And I think that's an indicator of a little bit of burnout.
Yes, I agree. All yesterday, I was thinking it was Wednesday. I was like, oh, I've got the lunch and learn. No. Yeah. What are some other signs of burnout that you guys have felt? I think it may just be you and me, Catherine.
Yeah.
They're at lunch. It's
Um,
okay. It's lunch and learn. It's
yeah,
okay.
right.
Right?
It is okay. Um, yeah, I work as a supervisor, so sometimes I have a little less patience, and sometimes I jump and react a little quicker than I normally would, which is
Uh-huh.
interesting. It's like if I would just give it a beat, things would tend to kind of work out sometimes. But when I'm feeling burned out, I just have like an immediate response, and I have to be careful to not
Hmm.
accept that immediate response
Yeah.
because it isn't always how I really feel about a situation. So I think that's a good sign of a little bit of burnout.
Yeah, that's probably true. Yeah, I agree. Like the thing that I was thinking about was sometimes I'm less patient with people in general. With
Hmm.
my kids, I'm really thinking about burnout really affects me at home. Like at work, I'm pretty good at holding it together, but at home, that's when it
Hmm.
really affects me.
Hmm. Hmm.
Yeah, like I I've spent so much time dealing with people at work that I don't want to deal with people. Deal with people. Deal with my family at home.
Yeah, you have less patience for them. You kind of
Mhm.
spend it all maybe at work.
Yeah, definitely.
Well, nice contemplating these ideas about signs of burnout with you. I have a feeling we're going to jump back into the main group in a minute.
Yep. All right. Well, nice talking to you,
Okay.
Catherine.
Yeah. Thanks, Grace. Bye.
Bye. Did this work? I think I'm doing this wrong.
Great, so it looks like we have everyone back.
Okay, I think so. I wasn't sure if I did that right. So
Yeah, no, this is good. So yeah, I really,
where I would just be that child.
somebody is, needs to mute. Okay, perfect. Thank you. So a couple things, I got to quietly listen in on a group. I usually try to make a joke. Hopefully we're talking about compassion fatigue, vicarious trauma, secondary traumatization. The group I listened to had remarkable insight. I just really appreciate the thoughts that you shared with each other, and really it was a privilege just to listen to you guys talk. So thank you. So we're going to move into the next steps of the presentation. So how does these things impact a human being? Next slide, please, Grace.
do you want the next
Great.
slide after this?
Yes, please. Thank
Okay,
you.
sorry.
Yeah, my apologies, Grace. So just some general information of different pains that people can go through. So just in a study, Florida hospice nurses, 79% reported severe compassion fatigue. That might apply to one of the persons that were actually talking about a situation in their personal life in the breakout session. Social workers experienced in a study in 2019, 57% have felt threatened at some point at their work. 16% reported being assaulted. Nurses 2017, 33% reported being assaulted. Here's something I found very interesting. Domestic violence attorneys reported higher rates of vicarious trauma than mental health professionals and social workers. Next slide, please, Grace. Just something that that's just important. Again, different professions. In a really significant study with surgeons, 1 in 16 reported serious suicidal ideation, and yet only 20%, 26% of them that reported that serious suicidal ideation actually sought help. Immigrant judges studied had higher rates of BO, that's burnout, not body odor, BO, compassion fatigue, and vicarious trauma than physicians and prison wardens. According to the Georgetown Law Journal, the words extremely burdened kept coming up. Next slide. So again, here's some of the impacts, some of the symptoms. Again, we hear that physical and emotional exhaustions, somatization. It just means the impact that stress can have on someone's bodies, headaches, migraine, poor sleep, increased use of drug and alcohol, as well as other possible addiction. By the way, this one is really associated with professionals reporting, again, not necessarily an addiction, but an increased use of drugs and alcohol that begin to impact them. You see the intrusive material, missing work. Next slide, please. We see the impact that it has on our work. So if it's work and we're impacted by compassion fatigue, vicarious trauma, we begin to avoid clients or find ways to silence them. And it doesn't have to be rude ways. It could be, oh, you'll be just fine. Just keep doing what you're doing, instead of having to listen through the story all the way through, or not returning phone calls, not returning emails, difficulties making decisions, poor memory, relationship issues, compromised care for clients and self, emotional exhaustion. Next slide, please. In the same thing, kind of similar, the distancing, not being available emotionally. You can begin to see depressed mood, feelings of helplessness and hopelessness, where you start to feel like this is not who I am, but I'm behaving a way that I'm not understanding. Diminished sense of enjoyment, disruption of worldview, increased vulnerability, and tolerance of intense feelings. Next slide, please. We begin to see certain thinking patterns lead us to compassion fatigue, vicarious trauma, and secondary traumatization. All or nothing thinking. It's just got to be one way or another, good, bad. Overgeneralization. I'm going to skip the example because I want to make sure we get to what do we do about it and not rush through that part of it. Where we take one piece of information and make a wide sweeping generalization. People have a tendency to do that, can be affected differently than the people that see more shades of gray. Next slide, please. Mind reading is when you start to assume you know what the other person's thinking. and begin to react to it. That's a thought process in itself. Emotional reasoning is how I feel must be reality. Next slide, please. Things at work that can affect compassion fatigue, vicarious trauma, secondary traumatization, burnout, poor management, and that could be a variety of things. Again, picking other people that do more favors, being able to not be reasonable in decisions, lack of supervision and consultation is a huge impact on someone, large caseloads, people being treated unfairly, poor boundaries, expecting you to work from home. This is not working from home from a technology point of view, but working after hours. Micromanagement. Micromanagement, just so you know, is one of the most toxic ways to manage someone. So whether it is meant to do this or not, the point of it is micromanaging. What it does is it just says basically you're incompetent, you're incapable of learning, therefore you must be controlled. It is a very toxic way to manage human beings. Next slide, please. So if you're in a toxic environment, the biggest thing that I always tell someone, if you're not in a position to make change and you clearly have identified your toxic environment, it is so detrimental to your health. Your number one job is to get out and get a new job or get out of that environment. And you try to do that in the most healthy manner that you can. You gather resources to help expedite that, and you try to remain really compassionate for yourself. And if you're in a toxic environment. Stress, here's what I want you to do. Next slide, please, Grace. The impact of stress that it has on your body. This is why when you start to have compassion fatigue, vicarious trauma, secondary traumatization, we really need to start taking care of ourselves, because what we begin to do is activate our flight or fight system. Basically, the amygdala alerts the hypothalamus that releases a chemical to the pituitary gland, and we start to have these remarkable changes in our body. We may not even be aware of it, but our heart rate increases, our breathing increases, we have more shallow breathing as well. Blood is being moved to major muscle groupings in our body. Our muscles begin to tighten. That's why with stress, you begin to see chronic pain that can happen. Energy is being moved from non-essential systems when our flight or fight system starts to kick in. So what that means is energy is being moved away from digestion, reproduction system, our immune system. We have our hippocampus, which is our speech center, is pumping out cortisol. So we experience as little pain as possible during a real stressful event. That's what its number one job. That's why memories around stressful events can be so hard and unreliable, because the part of the brain that's supposed to do the memory part really well, the hippocampus, is doing something else. So memories around stressful or traumatic events could be incomplete, not sequenced, and it can be like one piece here, one piece here, one piece here. That's why police have a specialist who does the interviews. For example, somebody who's been sexually assaulted. So you don't be, okay, what happened at 6:30? What happened at 6:35? Well, if the hippocampus goes offline, so to speak, that's not how the memories are going to flow. You're just going to start with one memory, move to the next memory, and then over time it becomes sequenced. So when this system kicks in, essentially you're as fast as strong as you can be, given your health and your age. Next slide, please. So what happens when we have ongoing stress, ongoing repeated exposure to trauma or stressful events, the amygdala becomes more sensitive. In other words, it turns on more often, more quickly. We begin to have muscle tension, so we begin to develop, some people can develop long-term chronic stress. This is why when we know personally in our lives, under exposure of long-term stress, people become sick more often. It's because energy is constantly being diverted away from the immune system. It also kicks in our inability to rejuvenate ourselves. So it stops us from being able to do that. We begin to see the impact that has on our cardiovascular system. One of the things when there is our flight or fight system kicks in, the liver's always pumping out glucose because we're going to turn that into energy. But if that keeps going over time, our body struggles to handle that extra sugar. Next slide, please, Grace. So what we can begin to see is the development of type 2 diabetes as a result of chronic stress. We begin to see impacts of other things. People become more depressed, poor concentration, chronic pain, heart issue, dizziness, high blood pressure, irritability, anger. These are just a few. Digestive issues, grinding of teeth, again, increased drug and alcohol use. Next slide, please. So, okay, so what do we begin to, next slide, Grace, thank you. How do we begin to see and improve the impact? Well, let's start off with the workplace itself. So if we have these positive factors in the workplace, this really helps with compassion fatigue, vicarious trauma, secondary traumatization. Debriefing, whether that's a formal thing that you do with a supervisor or an informal thing that you do with a colleague and things of that nature. Peer support, having support from your peers is a huge thing to help deal with or reduce the possibility of these things developing. Good and consistent supervision and consultation. Employees having some control over their schedule, having flex schedules, whether it's 410s, 5/9s, things of that nature. Ongoing training, I cannot emphasize this enough. Ongoing, productive, meaningful training. Being able to have ongoing professional development. Where do you want to go in your career? How does your current job help you to get there? Going to a cool conference. Things of those nature really help us with coping with compassion fatigue, vicarious trauma, or helps us not develop those things as a result of our workplace. Next slide, please. Okay, so what do we begin to do to try to right this ship? So the first thing we want to understand is our true exposure to stressful material and trauma. So I just asked people to do a couple of days of this. If you have like a Monday and Tuesdays, that's a typical day for you for a Monday and Tuesday. You can put this in your phone. If you have a notebook like me, a small one, you can just make a quick note of this. What you do is once you are exposed to a trauma material, you just hit a quick check or put a line there because you just want to see how much you're being exposed to. If it lasts for over 5 minutes or it's significant, you put a check or a slash plus so that you know it wasn't just a small one, it was a bigger one than normal. And then over a day or two, you begin to see how much exposure you have so that you know that you can be susceptible and you're gathering information. And if there's something you would like to do about it, would you like to reduce it? Would you like to have electronics turned off for a period of time while you're home? Things of that nature that are just really challenging for us to do these days. So the first part is getting aware how much trauma or stressful material are you constantly being exposed to. Next slide, please. The next step is, okay, how do we manage our compassion and our empathy? Because when we look at the core and the crux of these issues, compassion fatigue, vicarious trauma, secondary traumatization, or secondary trauma stress, what is at the core of it? It's our empathy that's having a connection to it. We're becoming overwhelmed. We're being impacted because of our compassion and our empathy. And it's because we are truly compassionate and empathetic is why we're being affected a certain way. So the question at hand is, can you manage your compassion while you're being compassionate? There is a way to do it without taking away from what's going on in the moment. So if you're having a human being that you're listening to that is going through a difficult time, there's a way to be compassionate and still manage your compassion at the same time. There are different ways to go about it. Like, for example, I know of a colleague who's a mental health therapist. When something intense begins to occur in the room, what she'll do is move her, I apologize, I had something pop up that shouldn't have popped up on my screen. What she will do is move her right foot back about 1.5 inches. That's it. In her mind, symbolically, she's kept a little bit of space between the pain and her well-being. Now, there's a concept called mindful compassion, as you can see on the screen. It's being present and open. You're not trying to change what's going on in the move. You're not trying to remove yourself from the pain, but you're managing. You accept it, you're open to it, but you don't identify with it. You don't take it on as yours. You identify it as the other person's pain, and you're there to support them, but you don't take it with you. Another one concept is called conscious empathy. Um, you are again allowing the pain to come in, allowing it to be what it is, and yet you're doing it without identifying yourself with it. It's like a visitor, something you welcome, you acknowledge, and then you say goodbye to. So all you're saying, it's not your pain, it's not your burden to have long term. This is someone else's pain, but you're there to support them. I just want to make sure, does anyone have any questions about um, these two concepts, or managing your compassion and empathy while being compassionate and empathetic at the same time? Okay, keep moving forward. Next slide, please. So the next step is, what do we do? We have to develop a personal plan. So each person's different. So that's why I don't say, okay, here's the 5 ingredients to make everything okay. Well, each one of you different. Some of it's going to be work related, that you're struggling with your compassion fatigue, for example, or it could be personal related. And we want to develop a plan that incorporates your specific situation. Now, what research shows overwhelmingly, if we could remember our purpose, it helps us to be more compassionate and empathetic. So why are we doing what we're doing? Why would someone become a social worker? Why would someone care for a family member? What is our purpose around it? What gives us meaning? And if we could remind ourselves every day before we go into the situation, that seems to make a huge difference. We're not as burdened by it. We're more present and less impacted if we remember the reason why we're doing it is because I'm a good person and I want to help a family member, or I want to help people that are struggling. So my purpose in life is to be the best social worker I can be, or mental health therapist, and so on and so forth. So we also, the reason why I want to take time to talk about our body and impact of stress and trauma on our bodies is to understand we have to do something with our body to decompress, to de-stress, so that we are dealing both with the mind part of pain and the neuroscience, in other words, how the impact pain has on our body. So what we want to learn to do is deep diaphragm breathing. Now, deep diaphragm breathing, the simplest way to do it is hook your hands behind your back and just start breathing. What that does is it forces the air down into your diaphragm. So why this is important, as you take 2 or 3 or 4 deep breaths, and you can do that anytime. You can do it at work. It only takes a few seconds of your time. Do it 5 or 6 times a day. Your heart and your lungs begin to synchronize, which signals the amygdala it's okay to turn off. In other words, your flight or fight system, or your stress reaction system. Again, deep diaphragm breathing. Now, some people with deep diaphragm breathing will feel a little lightheaded. This breathing technique works as well. In for 2, no, in for 3, hold for 3, out for 3. Do a rep of like 3 or 4, then go in for 4, hold for 4, out for 4. Accomplish the same thing. Heart and lungs synchronize, signals to that part of the brain it's okay to turn off. We activate the parasympathetic nervous system, which again allows us to calm down, relax, rejuvenates ourselves, that nervous system. Another thing is to be aware of your body throughout your day, because what most people will experience is their body will get stressed before they're consciously aware of it. So quick body scans throughout the day, again, only requires 5 to 7 seconds of your time. Are you noticing anything hurting, tightening up? If you do, a quick stretch, a brief walk, things of that nature, so that you become aware of decompressing before it becomes something so more intense and becomes harder to decompress from. Simple mindfulness techniques that you can do at work or at home, just to alleviate stress, or to get yourself more present, is you can grab something like a pen and just hold it in your hand and begin to mentally describe it to yourself. The different parts, how rough it is, how smooth, how cold. And then here's the last part. It sounds a little weird, but you'll be interested. It'll be interesting what your reaction is. The last part of it is, how do you feel? How do I feel about this pen? So we're connecting our mind, our body, and our emotions together. So if you're at work, it's really important at work that you get away from the office one way or another. So if you're on break, it'd be nice if you could get outside your office, especially if you're in the helping field. Um, and if you can't get away from work physically, get away from work mentally. Get on your phone, plan your next vacation or your next small trip or something that just mentally allows you to check out. What we find is if people can really decompress and mentally get away, they actually are more effective in getting work done. A lot of times people go, I got too much to get done, I can't take a break. What we find research-wise, if you take a break, you actually do better at getting everything done. And so getting a break is really, really important. Believe me when I say this, I know that feeling like I can't do it. Just if we can get in the routines of doing that, very, very helpful. Um, Debriefing, if you don't have anyone to debrief with after a hard situation, go grab someone. It could be informal. It doesn't have to be with a supervisor. We just know if you talk about something, you're more likely to work through it. Talking with colleagues on breaks, people do this naturally. I just want to kind of like, hey, don't forget when you're talking on break, you might just want to talk about other things other than work. Leaving work, having what we find research wise, having a ritual where you are distinguishing leaving work from behind. Some people could be, they get home, they just change their clothes, they put on music when they're driving. If you are having something go on in your personal life and you have to deal with some, once you're done with it, make sure you have some sort of ritual that says, okay, I completed what I needed to do. I know I got to deal with it next time, but for now, I can move forward and be more present in whatever's going on in your life at that point. Next slide, please.
Hey Keith, there's
Yes.
a comment in here that talking about getting away from the office. Nancy from DCYF says, however, leaving work doesn't alleviate the problem. When going back to work, I'm thrown into the same place as when I left. Do you have anything to comment about that?
So I just want to make sure I'm hearing everything right. So when you're saying leave work, so it would be helpful if I knew the stress, was it the clientele? Was it the system? If it's a clientele, we have a couple strategies that can work really well. I'm sensing it might be more systemic in nature, which is really, really hard to manage. Um, uh, I don't want to be negative about it, but it's really important, the self-care after work. I know it's 100 times easier for me to say than to do. Getting the real breaks away, trying to remember why you're doing what you're doing and how to implement that, even if there's some dysfunction going on. Being able to um, being able to talk to other colleagues, talk to, if there's a mentor that you can go to that can say, this is what's happening to me. How do I navigate this successfully? I don't want to leave this job or this field. I want to be able to navigate this part. Those are just some suggestions. The systemic things are the most painful ones. So I hope that's helpful. If not, if it's helpful at the end, I have my email. I'd be happy to talk to you more. You can email me and um, uh, you can email me and I'd be happy to talk to you. Yeah, so dark humor does make a difference. That was one of the things in the chat. But we're also very careful of when and where that can happen. Um, and what's appropriate, what's not appropriate. So having a sense of humor that's not belittling in nature and not hurtful to other people um, certainly can have a positive impact on your well-being. Next slide, please. Okay, we already talked about. Here's the biggest thing research shows. We've got to get off electronics at some point in our day. If we don't, it has a huge effect on someone's well-being long term. That's really hard to do. And we're talking about phone, I'm old enough where if I made a phone call to a friend and they called me back in 3 days, I didn't consider that being ghosted. That was actually a normal thing, and we had these little tape cassettes that you would record your greeting on. But we have to find a way to decompress from electronics. I mean, it's really important that we do that. Again, nutrition, try to eat healthy when we can, not all that. I know we don't have to do it all the time. What we also found that's really important on the next part of the slide is we have to, with compassion fatigue, vicarious trauma, and secondary traumatization, we begin to take care of ourselves. So it's really important that you make your personal appointments. And I'm not just talking about mental health. I'm talking about doctor's appointments, dentist appointments, whatever appointments you are that take care of your well-being. It's important that you do that. Exercise, again, you don't have to go join a gym, but just some walks, anything like that, stretches. Make sure the weekends you're not working and they're really your weekend and your time to get away from things. Next slide, please. Make sure you take vacations. Make sure you're engaging in your hobbies. If you're doing some work at home, which I understand sometimes happen, make sure that's the exception, not the rule. Just remember you're important. Alcohol and drug use is a common thing among professionals to increase. Don't be afraid, not just for drugs or alcohol, but don't be afraid if this is affecting you some way to seek out professional help. Next slide, please. One of the things I want to reassure you is there's something called post-traumatic growth that occurs. It's a phenomenon that's occurring across the world when people go through trauma. They experience a positive change in their life they never experienced before as a result of working through really difficult and painful things. There's something called vicarious post-traumatic growth that's similar, as they struggled and it was hard to work with and deal with, that they actually ended up growing from that experience at some point because they coped with. Again, it's just another way of saying things can get better. The first part is identifying what's going on. The second part is developing a plan and what that looks like. And of course, the third part is implementing and having support for that implementation. Be around people who are not judging you. Be around people who encourage you to work your plan and acknowledge what's going on. As we do that, here's what the research shows, and here's what's been in my professional experience. When people do that, people get better. So I know that was a ton of information in a short period of time. Like I said, my email is on the last slide. Please feel free to reach out anytime. And I'd be happy to give more resources or information. And thank you for participating. There were a lot of people that joined in. I'm just glad that so many people came. And I sincerely hope this has been helpful to you in some way. I'm trying to give you, Grace, a couple of minutes. I know you need to wrap some things up, so I'll turn it back over to you.
Thank you so much, Keith. Were there any questions that you had for Keith that were on your mind that you wanted to popcorn while he's here? Keith, I had a lot of people requesting the slides. Is that okay if I send those out to you?
Absolutely.
Or send them out to people? Okay,
Absolutely.
awesome.
Yeah.
Thank you so much, Keith. This was a lot of information, a 3-hour presentation packed into 1 hour. Thank you so much. I had talked about upcoming lunch and learns that we're doing. So May, in addition to Mental Health Awareness Month, is also Celiac Disease Awareness Month. So pairing those two together on May 31st, our Wellness Committee is having a lunch and learn about the psychological and social impacts of having celiac disease. So it's kind of a what I wish people who don't have celiac disease knew about celiac disease and how it affects me. And then on June 27th, we have an encore with Keith. June 27th is PTSD Awareness Day, and the month is dedicated to PTSD awareness. So on June 27th, Keith is doing another lunch and learn about understanding trauma. I have got a hand raised. Nancy. Has lowered her hand. So if you want the flyers, go ahead and email me. My email address is our wellness email address is wellness@dva.wa.gov. I'll put that in the email. Wellness@dva.wa.gov. If you want the slides from Keith, let me know. If you want invitations to the upcoming lunch and learns, let me know. And thank you so much, Keith. If you want to give a round of applause or under reaction, do the applause reaction. Thank you so much.
Thank you.
It was really,
My-
I've heard this before, but it was so good even the second time. It was so great.
Yeah, my pleasure. Thank you all very much. I hope you have a wonderful afternoon.
You too. Thanks, Keith.
Bye-bye.
Oh, hi, Celeste.
I was like, oh, there's like hardly anyone left. I'll say hi.
These people aren't even here anyway.
So yes, I just thought I'd say hi.
Hi. Thanks. Thanks.
I'm working from home today, and the dog's like, you're home. You should be like paying attention to me, not anybody or anything else. I'm like, girl, here's a bone. Like, go away.
That's funny because I have a picture. I took a picture of me with my dog leaning up against my leg. I was like, oh, this is how I deal with compassion fatigue and burnout,
Right?
is having my dogs like tied to me.
Can you see that? I don't know if you can see it.
I can't.
Kind of. I'll send it to
Oh,
you.
there we go. There we go.
Yes. She's literally got her bed in here by my feet and was sitting there like, excuse me. Like, you're supposed to be paying attention to me since you're home.
Right. All right, cool. I gotta send the flyers out. Send the flyers out. Send the things out. So,
Powerful.
all right. Thanks, Celeste.
Two, please.
Okay, I will write your name down, Celeste.
Thank you, hon.
Bye.
Have a good afternoon. Bye.
You too.